So it's a lot of
Yeah.
mask talking lately, but it makes sense because the whole world has been and is talking about masks all the time, whether to wear them, not to wear them, which
Yeah.
ones are they good, not good, what's the point, what's not the point. What are your views as someone from Hong Kong, that you have that in your culture anyways, because you've had experiences in the past with other epidemics, so maybe you can even tell us about that. What is your view of the rest of the world, most of the rest of the world, that keeps on debating whether to use or not to use a mask?
Okay. I'll try to keep myself short because the main point is that I believe you should wear a mask to protect yourself and also to protect the people around you.
Mhm.
And I'm the kind of person, like at least personally for me, I'm the kind of person who wears a mask whenever I'm sick so that I can so that I can prevent people from around me from getting the same flu, flu or whatever that I have. And then for Corona, I mean, okay, so let's go a little bit back to SARS 17 years ago because Hong that was when we in Hong Kong first had a taste of an epidemic, and that was when we realized that masks are actually vital because I think that was mostly driven by fear because in those 2 or 3 months of SARS, I think I don't really remember because I was just a kid at that time, but I remember everyone was so scared of just leaving their homes. It's like they were voluntarily conducting lockdowns within the community. And there were there were at least 7 doctors or nurses or healthcare providers that passed away. And also the infection number was close to 3 or 4 thousand. Okay, now don't quote me on that because I don't really remember the figures. I'll probably get back to you in a bit when I actually read up the numbers. But that was a really hard lesson because like the economy was really bad and everyone was literally afraid of stepping out of their homes. And not to mention that there were some residential complexes that didn't really have the best drainage system. And then the virus spread inside the building with the bad drains. So there were a few complexes that had to be completely evacuated and then revamped because they were literally like harboring the virus. So it made us really paranoid. And with this fear, I think it mostly governed Hong Kong's reaction towards the COVID because we want to protect ourselves the best that we can, especially when there are so many variables out there. And especially when we know that China has a history of concealing up figures just because they don't think that is necessary or just to protect the good image. Some of us learned to distrust China and therefore were a few of the earlier ones to procure masks. Like my friend was the one who introduced Cambridge to me, and
Mhm.
she actually got them shipped here in mid-January. So this is how much she does not trust the official data. And then there are other people who realize that this epidemic is not simple stuff, so they started getting them late in mid to late January when the masks were still at a lower price. I wouldn't say it's the reasonable price, but at least not like charging you 50 euros for a box because that happened.
Mm.
And yeah. So basically I think Hong Kong's reaction about masks and at least mine and also mine, I wouldn't speak for everyone, but at least for me, is in parts governed by fear about the for the unknown because we do not know um how infectious COVID is. We do not know the results, how you would be after you recover, if you recover, and
Exactly.
how was it transmitted. And I think that played a huge part in our reaction. Yeah.
And from what you were telling at the beginning of our conversation, obviously things in Hong Kong in respect with the pandemic, things have stabilized. You barely have new cases, and if you do, they're usually imported cases. but you are still wearing masks. It
Yeah,
is
everyone is.
everyone is, and yes, of course, it was already part of your culture. It was already part of the knowledge that Hong Kong had with the epidemics in the past. But at the same time, it's the knowledge, correct me if I'm wrong, that it really just takes an exception. It takes nothing, that if you don't control it, then you can have another outbreak. You can have,
Exactly.
so yeah.